Okay, the Finance Committee will come back to order. And I'd like to recognize Ms. Clark. We're on item 5B.
Okay, so, this action would allow us, I need my pension slide. I'm gonna quit clicking and I'm gonna let them pull my pension slide up. We have the opportunity to fund for the year our defined benefit plan. Not like I'm a rookie. We have the opportunity this year to actually fund our defined benefit plan expense. We actually have a plan where we fund 6.75% of participant payroll. And that would calculate out to a $17.3 million number for the year. And we have about 5,400, that's worse with me on the screen. We have about 5,400 participants in the plan right now, 3,800 of which are active participants within the plan, meaning that they're still currently employed at JPS and moving forward with that. So once we actually, if we do make the $17.3 million funding, our plan net position will currently be at the 99.2% rate. At the bottom of the screen, that would allow for the actuarial liability, which is a complex calculation based on each individual participant. It's kind of a smoothing liability, so we don't incur a higher expense in later years. When you compare that to the market value of the assets currently, we are 99.2% funded from our net position. Jumping back up to the third line on the screen, the actuarial liability amortization period of about 4 years will let us know if we continue to fund at the current rate and earnings stay relatively the same, that within 4 years, the plan would be funded for current participants in activity. So by doing this, we do create a very healthy pension plan, and I would be asking for the approval of the $17,304,696.
Okay, you've heard the description by Ms. Clark. Any questions? Okay, I entertain a motion. Oh, yes, sir. I'm asking Mr. Powell to make
I would just like to say,
motion
Mr. Chairman, I'd like to request approval of the annual contribution as noted of $17,304,696 to the JPS pension plan for plan year October 1st, 2017 to September the 30th, 2018, and the amendment to the JPS pension plan has been discussed.
So we have a motion and a second by Mr. Wynn. Any questions? All in favor of the motion, please. Yes, sir. We do at the end of the
You make the contribution based upon.
Good
yes,
clarification, though. All in favor of the motion, please say aye.
Aye.
Opposed? Motion passes.
Need to abstain.
And we have one abstention by Ms. DeBose. Please note for the record. Thank you. And item 5C.
This is for the GIBA funding plan. This year, we are requesting funding of $64,854.
Okay. Any questions for Ms. Clark? We have a
Mr. Chairman,
motion
there
by
being
Mr.
no
Powell.
questions, I'd again like for everyone to consider approval of the annual contribution of $64,854 to the Tarrant County Hospital District's governmental excess benefit arrangement for the plan year October the 1st, 2017 to September the 30th, 2018, and amendment to the TCHD governmental excess benefit arrangement and resolution authorizing the amendment of the JPS pension plan and appointment of the GIBA participants.
Heard the motion by Mr. Powell. Do I hear a second? Second by Mr. Petty. All in favor of the motion, please say aye. Opposed? And we have one abstention from, is that, actually, do you have to abstain on this one?
I don't know if I have to abstain from that one, just from the first.
So are you voting aye?
I'm voting aye.
Please show Mr. Bose voting aye. Thank you.
Thank you.
If there's no other business before the committee? Any other any other kind of business? Motion, we've adjourned. Thank you. Good morning, everybody. Welcome to the Finance Committee meeting on July 20, what is it, 26th? 26th, all day long. All right, the Finance Committee will come to order. Our first item of business is any citizens wishing to address the committee. None signed in. All right, we'll move on to item 3, which is approval of the minutes from the June 28th meeting. I'll entertain any motion on that. We have a motion and a second by Mr. Bose. All in favor of the motion to approve the minutes, please say aye. Opposed? Motion passes. Thank you. We'll move on to item 4, CFO report. Ms. Clark. Good morning.
Good morning. So I have 2 things to cover today during my report. The first one is just to let you know that the June 30th Hilltop report is out on the portal for our investment performance. If you have any questions, just let me know. They will also be joining us in person to cover the 9/30 results for our fiscal year. I believe that would be scheduled in December. So
Okay.
just as a reminder, we post those quarterly reports and then they come and give a face-to-face
All
once a
right.
year.
Great, thank you.
The one thing that I have kind of given you notice that I would be doing today is trying to give you a good picture of where we might be ending up fiscal year 18. We've got a couple of months left, and so I'm going to jump into that, and then I have a slide of major points of interest that I think that we're trying to incorporate in the budget that you're going to be seeing next month. So for the fourth quarter results, I'm going to be presenting June here in just a few minutes, but our operating gain through June, and this is just for the medical center, is $1.1 million. We have done a lot of work to try to figure out where we will end up in the last quarter for the year. I believe that's going to be a loss of about $1 million. There's a few things that impact the trend rate that we've had the first 9 months. And mainly, it's a lot of timing. So throughout the year, we've talked about we're under in minor equipment. We're also under in some of our consulting. We've delayed some of our computer replacements throughout the year. And so a lot of that activity is going to happen in the next 90 days. So some of those expenses that we had been projected a savings on when I'm covering are now going to start to catch up. And that is part of what's driving that $1 million loss for the last quarter. So projected gain is going to be right at break even. And let me also preface that the break even, we have not included any changes in our supplemental funding. That's still being discussed right now. Obviously, when I sit down and talk to you about the budget, we're going to have to land on a number, but we could have some significant decreases in fiscal year 18 because of the formula funding that impacts DISH and UC both.
Could be 20 million.
It's a very large number. It could be, yes. That will also begin to impact our assumptions for fiscal year 19 as well. The next section, I want to spend just a few minutes on talking about DSRIP. So the DSRIP program changed fairly significantly from the first 7 years that we were under DSRIP, and a claim has always carried one metric, one bundle of metrics from DY1 all the way through DY7, and it was pain management. So when we look at the Acclaim financials, we always had some DSRIP revenue within that company. Since everything changed this year, we had submitted the metrics, and Acclaim carried a diabetes metric, kind of a bundle for wellness for that population. And in a review, HHSC decided that that might be some double counting from a system standpoint. So they've asked that that metric be moved back over to the medical center. So from a consolidated standpoint, we will continue to be able to achieve the same dollars, but what's changing is we will not be able to recognize DSRIP on the Acclaim company. It's going to be all recognized on the medical center. So you will see that when we close year end. And so the projected gain, again, without any of the supplemental changes, would have been probably around 4.4 million. But I did want to disclose, it's just coincidence that it gets us really close to that original budget number.
And what we'll see is a corresponding change in the Acclaim numbers as well.
Thank you for the segue. Yeah, just 2 more slides, and you're going to see a big negative there. So now, from the medical center budget, there's a couple of items, again, that we have been able to already identify, and I wanted to introduce you to some of those changes that may be occurring in 19. We did get our certified tax roll at the end of last week. That's going to equate to a 9.8% increase in our tax revenue. We're also going to continue to focus on revenue cycle in the collection of patient accounts. We are always looking at utilization in care management. Our focus, again, is going to be the appropriate level of care while they're in the hospital and an efficient discharge. Volumes are remaining relatively flat. The only growth that we are projecting in inpatient is because of an increase of 9 beds in progressive care. We have converted rooms to semi-private to pick up 9 additional there. And from an outpatient standpoint, they're flat with the exception of about a 2% increase in some of the community health visits, both the specialty and primary areas. We have some new leadership in behavioral health, so new eyes bring changes and a refocus on that service line. And some really exciting news, the Northeast Medical Home will be opening, I believe, beginning of October, and start to serve patients. Mobile mammography, we're continuing to work through that service. The Cancer Center, the new lease at the end of Magnolia will begin to be operational during 19. And we're also going to continue efforts to design the ASC and the outpatient surgical center that sits over close to the pavilion. So for Acclaim, again, we'll present a number that's about a $10 million loss, and they are right on budget to date for the first 9 months. The quarter ending, we expect another $4.9 million loss, which will bring them to just over $15 million. Their original budget was about 12. A big reason that they are not on their run rate is just due to physician turnover and recruitment in the last quarter. I believe in the budget, we had expected all FTEs would be onboarded in June, and they're actually having a net of 17 providers come on. The first quarter, probably the first 6 months of a new provider, they incur a larger loss those first 6 months until they get up to speed with a patient panel and with their billing and collecting. We also have, we have accessed a lot of our medical director and admin time in the first 9 months, so that's going to be decreasing slightly. And no matter how hard we try to budget for the fluctuation and kind of the CME expenses coming in towards the end of the year, we expect that the providers will access those funds, but they have been budgeted in the first 9 months. So there's a pretty large dollar amount that's still available for them before September 30th. So we've included that in the projection as well. The reclass from DSRIP, that's just a negative 4.4 million. Again, from a system standpoint, we still are eligible for that bundle. It's just going to be recognition on the medical center, and our projected gain will be 19.5. Projected loss, I'm sorry about that. So from the Acclaim standpoint, some of their newer budgeted initiatives, we're showing about a 6% revenue growth because of the recruitment and the full year impact of some of those providers, growth of urology, expansion of maternal fetal medicine. We have a one-time academic funding for this year that will not be recurring in 19. And then just the full year impact of all of those physicians that have been onboarded, and there's a net of 41. So we've had some leave, but the 41 is just the net increase of employment. We're also transitioning dental providers and hygienists to Acclaim from JPS. And there's also going to be a transition of correctional health professionals from UNT. They service the jail population and the contract that we're responsible for there. That is really the last of the prepared comments that I have. When we present budget to you in a few weeks, I believe it's on the 7th or 8th, but at the next board meeting, when you see projected, those projected numbers are going to be what are shown. And I'll likely be showing the format a bit differently to take into account what's happening operationally and then what's happening with our supplemental funding.
Okay, any questions for Sharon? Mr.
Mr.
Powell?
Chairman, the only thing I'd like to make sure, Sharon, we're still, back on May the 10th, if you remember, we posted the board meeting as a budget retreat. We didn't go off-site this year and do that. GK Manus was here that day, and we went through a lot of things. The tax roll was the next thing, was to be certified on or about July the 24th. And then I think your plans are to have up on the board portal by the 3rd, the budget. And that will give the board the entire weekend all the way into Monday. And then you and your staff are going to designate that day kind of as budget discussion with board. Anybody wants to call, go over anything, they can call you and designate it. Y'all have got the time available to answer any board questions. And then it actually comes to our board on the 9th of August, then hopefully approved here, and will then go to the Commissioners Court on the 21st, I think, or whenever the next meeting, that's Commissioner Court's business. But I just want everybody to remember, we kind of had these timelines set up from that May 10th date. So I know you've been working on a lot of numbers, so thanks for you and your staff and everything's going on. Steve, I know you've been very busy with that, so I want to say thank you to you and the staff.
So thank you, Charlie, for that. So in about 2 weeks, you will be receiving the PowerPoint slide that I typically mail out every year. And I will also make sure that you have my contact number. So if you do have any questions on Monday, again, we've already blocked out our day, so we will be sitting there happy to answer any questions that you might have before that date. Again, if you're not able to call in on Monday or reach out, please do not hesitate to reach out to me prior to the Thursday meeting. I can kind of change the presentation or the comments that I make to accommodate your questions, because they're probably questions that someone else might have on the board. So you can always call me up through Wednesday, and then we'll be here Thursday to review the budget.
Super, thank you.
Up through 12 midnight Wednesday? I mean, is there a cutoff time?
These next couple of weeks, no. There's not.
Terrence,
I will
do
be
you
at
have-
my desk.
Thank you.
Let me ask you one question. I noticed that one of your unfavorable variances on purchase services was the replacement for IGT. So when we see reductions in supplemental, like we're continuing to see each month, is there a corresponding reduction then in what we use to replace IGT, or are we still responsible for that full initial contractual amount under that replacement program?
So, when you're talking about the LPPF, which is we're collecting dollars from all of the healthcare providers in Tarrant County.
What's LPPS?
It is the taxing, the local provider participation fund. It is, actually, those IGTs are not on our balance sheet
Okay.
or our income statement. They are, we IGT on behalf using the LPPF funds for other providers. The expense that's on our income statement is just the IGT that we make for JPS.
Oh, okay.
And the offset to that IGT is also, and I can show you when we get to the income statement, it is offset by an increase in the Medicaid managed care payments that we receive from the Tarrant County managed care organizations.
Okay, so that would wash our particular.
It does.
Okay.
There is a slight unfavorable impact for us discontinuing the offload contracts.
Yeah.
So, at the end of the year, because of the accrual process and because of, we'll have a better idea, but all of those things pushed together have to be netted to be able to evaluate the impact of that program.
So for next year, then, you should be done with any of your offload elements, and we should be able to have a clean slate going forward, right?
Correct. We will have the budget better aligned to what the process is now with the LPPF.
So when you're looking at next year's budget, how are you guys sort of visualizing supplemental funding in light of what you've heard and where we are today?
So we're still working through some calculations, and of course, Mike Spivey is a big resource
Sure.
to be able to do that. And there are conversations that are currently going on with the state about which distribution formula will we be using. So Steve mentioned a number. That's the number on the table right now. So what we're going to try to do for budget is kind of what I've tried to do is lead the management team through a budget process where, without the LPPF funding, we're shooting for the 1% return on the medical center, and also funding any of the additional claim losses.
Okay.
And then we'll have to consider the impacts and effects of any decline in supplemental funding, because with that amount, there's not really anything we can do in 4 weeks to try to make that up.
Yeah, and that's kind of my point behind the question, because as we contemplate contributions toward bond programs and we contemplate ultimately looking at our own reserves and fund balances, one thing we just got to be incredibly conscious of is what our projected undesignated, unreserved fund balance looks like against these continued reductions in supplemental funding. And I mean, I'm all for making all the contribution that we can, and I think we can and we will. But I want us to be conscious and conservative when it comes to understanding that is a constantly reducing stream of dollars that we have no control whatsoever on. And to keep our O&M portion of our rate where we need it to serve our patients, we just got to be conscious of it.
Yep.
Correct.
Thank you.
Thank you.
Yep.
Okay, so I'm going to cover the month of June. If you have any questions, please let me know. In my opinion, there's not anything large that is significantly different about June. It was kind of a typical month so far this year. Admissions were right on budget. We were like 0.1% under, so even though the box is yellow, it is right there. We did have a little bit lower case mix this month. We had quite a few more medical than surgical patients in-house, and with surgeries being down, the CMI is typically trending along with those two factors. And our length of stay continues to be right at 4.95 days. Our outpatient statistics, ED and urgent care were both under. ED was about 3% under budget, and you can see on the blue bar for urgent care, they were close to 9% under budget. Our primary care visits dipped a bit, about 3%. You can see that we budget for them to be lower during the summer months, and our specialty clinic visits were about 3% under as well. So in our other stats, you can see our invasive lab continues to be really high over here, above budget by about 13%. That's been the trend for about the last 4 months. Our inpatient surgeries and our outpatient surgeries are under, but you can see a nice increase from the beginning of the year. They're trending about 4% and 3% under respectively. And for psych, we've had pretty close to budget, about 4% over on our days. And you can see that even though we are under budget for our outpatient areas in psych, they have been trending about the same for the last quarter. When you look at some of our financial metrics, our days cash on hand available for operations, so this is kind of setting aside the future fund, is about 210 days. Just a reminder, that will continue to decline probably through November, December until we start to receive some of next year's tax collections. Our net AR days remain constant at 49, and our FTEs per APD remain favorable at 5.61. Our end of year target is 5.80. And that is a year-to-date number for us. On connection enrollment, we did have about a 1% increase. That represents 360 enrollees. We had a discussion last month about, there's always folks who fall off of connection and then re-enrollment. On average, for the last 3 or 4 months, we've had about 3,000 a month that roll off. So even though we're only increasing net that 361, we actually re-enrolled 3,361. So just to make you aware. So for the month of June, we had kind of a break-even month compared to a budgeted loss of $269,000. Again, our biggest variances, back to the discussion we had earlier, is in net patient revenue as well as purchase service. And that goes back to the Europe program, where we're getting additional dollars through our Medicaid MCOs, and we are IGTing on behalf of ourselves, an additional dollar that's coming in purchase service. So on the top side, we had about $2.1 million that we're expecting to get in addition for that URIP program. We had to IGT about $1.3 million, but some of the offload, the unwinding of the offload cost us a little bit. So it's kind of a break-even proposition at the end of the day. Our other overages, of course, salaries. We did have some pretty strong inpatient days with our increased length of stay, so staffing requirements, as well as some overages in the outpatient areas. On benefits, you can see those are trending above. We did have another higher health insurance experience for our employees. That cost us about $890,000, as well as some FICA makes up the rest of that. So we are continuing to watch our benefits and how those are designed and how employees are accessing care. So we'll be bringing back some ideas through the budget and hopefully help control some of those costs. Year to date, we are about $1.6 million behind our budget. We do have a positive bottom line of that $1.1 million that I kicked off my first presentation. Are there any questions on the medical center? Moving on to a claim. A claim has an underage. You can see the trend in the blue bar. This month, we're about 13% under. There are a lot of vacations in June, and you can see that, you know, the trend has gone down from May. When you look down at the net operating expense per encounter for the month, you can see that we had an unfavorable calculation, but the more important part, I think, is year to date and how do those first 9 months look to budget. And we are still about 2% favorable for our expense per encounter. So for the claim side of things, again, encounters were down, which is driving a lot of the net patient revenue, as well as some open positions that are creating a savings in the salary and the benefits line. Our purchase service is a bit over, but just as a reminder, that is the surgical group that was budgeted to be in salaries, but we do have some contract labor. They're permanent, but they are coming through a purchase service for that surgical specialty. And then, as I mentioned earlier, a claim is right on budget year to date from an operating loss standpoint. And that is all of my prepared comments, unless you guys have some discussion.
Any questions for Sharon? Okay, I'll accept a motion to accept her report. Motion by Mr. Nguyen, second by Mr. Powell. All in favor, please say aye. Opposed, motion passes. Thank you, Sharon. Why don't we move to item 5A?
Okay. This has to be one of your favorite things every year. And that was a serious comment.
Actually,
We have the opportunity once
I'm
again
sorry, hold on a
to-
second, Sharon.
Yes.
My bad. We just did 5A. And 5B and C, I'm going to need to move to closed session discussion before we bring them out for
Okay.
full discussion.
We can do the benefit plan.
He's
Oh.
bigger than you.
Oh,
No.
okay.
He-
I'll come back. How's that? I'm here all day. Okay. That'd be great. Thank you.
So now we're going to skip down to, we'll do that on B and C. We'll skip down to item 5D. and Mr. Rule.
Good morning.
Morning, sir.
We're here to seek approval of the fourth modification to an office lease between the district and Andrews Dillingham Properties. That location is 501 West Main in Arlington. It houses our eligibility and enrollment center in Arlington, as well as our partial hospitalization program. It's for a 3-year extension with another option for 24 months. This will be reflected in the fiscal year 19 budget. This doesn't go into effect until November 1st of this year, but we're just ahead of the game. The rent for the upcoming year is the same as the expiring term.
Awesome. Any questions for Scott on this?
It is, and I'm glad you mentioned that, because as part of this, this lease extension, we've also been able to cap, the landlord also offered to cap the triple net, the CapEx, for the next 3 years for this term, so that's really good. So property values go up, our triple net's gonna remain the same.
Sweet. Any other questions for Scott?
No, we don't anticipate any leasehold improvements for this 3 years. Yeah, good question.
Okay. Motion by Mr. Nguyen for approval, second by Mr. Bose. All in favor, please say aye. Opposed? Motion passes.
Great,
Thank
thank
you,
you.
Scott. Item E, Pia Walker.
Good morning,
Pia.
everyone.
Good morning, Pia.
This morning, what I would like to do is ask for your approval for the First Amendment for the Maxer Pharmacy Benefit Management Services. The cost for this is 1.7, which remains the same as our prior year, and this is for us to remain our business relationship to provide pharmacy benefits for our team members.
Okay. Any questions for Ms. Walker? Entertain a motion. Motion by Mr. Petty,
Second.
second by Mr. Bose. All in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. Thank you, Pia. Item F, Jamie.
Good morning. I'm here to seek approval for the modernization of elevators numbers 22 and 23 in the main parking garage. During normal operating hours, these two elevators are under constant demand from our patients, visitors, and employees. And these elevators have been in service well past its usable life, and parts for repair are becoming obsolete. I'm requesting the Finance Committee Board of Managers to consider approval of the proposed agreement between JPS Health Network and ThyssenKrupp Elevator Corporation for this elevator modernization. Subject to General Counsel's approval of the final legal terms. Last night, ThyssenKrupp's legal team requested some minor revisions to some of the language in the contract, which will be resolved before the August Board of Manager meeting.
Any more clarification from your? No, that's. So we do have some, yes, sir.
Vizient is the group purchasing organization that we are a member of.
It's the combination of the old VHA and Red Assets combined on the GPO side.
Group purchasing organization, yeah. Okay, any questions for Jamie? I'll entertain a motion on this item. Motion by Mr. Nguyen, second by Mr. Powell. All in favor, please say aye.
Aye.
Opposed? Motion passes. Thank you, Jamie.
Thank you.
Dr. Elliott. Good morning.
Good morning.
Good morning.
Morning.
Thanks for having me. Well,
for
I'm
being
bringing
here.
good news to start with.
Good
So
news.
look forward to presenting that to you guys. So I've got two agreements to present. The first one that I'm asking for approval from the board here, Finance Committee, is to approve the JPS University of North Texas Health Science Center Graduate Medical Education Formula Funding Agreement. This has been a work in progress, and it brings revenue to our organization to support our teaching endeavors here with our residency program specifically. It helps in terms of the state GME formula funding that's given to the medical school. in specifically to UNT Health Science Center and to pass through 80% of those dollars to JPS specifically for our programs. The dollar amount that you see there in your executive summary has actually been increased. We just got some information this week that the per resident amount was increased to $5,824, so that brings our total that will actually invoice them to $815,360. So that gives us a change of $30,000 there that you see in the executive summary. Also, just to really clarify for you, you have the date there and the ending period of 8/31/19. The agreement is actually a one-year agreement. We worked with our legal team very closely because we wanted to expedite the payment for this fiscal year to come through. So we split the agreement into two agreements, a one-year and a five-year agreement. The five-year agreement will be coming before the board as they also process it at their institution with their board, and we look forward to bringing that five-year agreement to really have that ongoing support for our programs here. So this will be a one-year agreement ending 8/31/18, and we seek your approval to bring this revenue to JPS.
Okay, thank you, Tricia. I know you've been working on this a lot, so thank you for that. You're welcome. Yes, sir, you have a question?
Is this for TCOM or is it for the new medical school? Does it get confused?
This is not with the new medical school. So this is with specifically with the University of North Texas Health Science Center with TCOM. But it really goes to the Health Science Center as they look at that. As the new medical school comes on board, I know the state will be looking at all of these new medical schools across the state that will be coming on board and whether or not they will be expanding that, but that's not there yet. The medical school will be looking to get their accreditation finalized by October this year and then have their first class by next year.
Great, thank you very much. Any other questions for Tricia?
No, I just like to say, I know Dr. Elliott's been working on this for quite a while. And anytime you bring something and the number goes up on the revenue side, I would certainly make a motion for approval of the hard work's done here. So,
We have a motion of approval. There's a second. Second by Ms. DeBose. All in favor, please say aye.
Aye.
Opposed? Motion passes.
I'm abstaining.
Oh, and one abstention, please note for the record. Abstention for Mr. Nguyen.
My daughter attending that school, so I want to make sure we're on the safe side.
Duly noted.
we might need to move that up some more.
Thank you so much for that support.
Dr. Elliott, you up for the next one?
Yes, I am. So the next one is actually approving the First Amendment to our Medical Education Affiliation Agreement between our acclaimed physician group and our Tarrant County Hospital District. As you know, we do strive to support our teaching programs, supporting our core faculty, and supporting our program directors to really be able to provide the administrative functions of our residency programs and our non-billable teaching time. We've been working very diligently over this year to create a new formula that really can be applied across all physician groups. And it incorporates the Association of American Medical Colleges salaries. Those come out, we utilize those, and utilize those probably every couple of years, 2 to 3 years, to be able to accommodate this formula. It's been ongoing discussions and agreements, and we have this new formula, and we are asking for your approval to be able to have this in the budget to move forward to a claim.
Awesome. Great. Heard that explanation from Dr. Elliott. Any questions?
Move approval.
Motion by Ms. DeBose. Second by Dr. Weber. All in favor, please say aye.
Aye.
Motion passes.
Hey, thank you so much.
Thanks for the good news. All right, item 6, any report from council?
I've got just a short report on the contracts over the previous month. For the month of June of 2018, we had 24 contracts under 200,000, and we had 5 that fit in between 200,000 and 500,000 for June of 2018. That's
Okay,
it.
and these are on our portal for review?
Yes.
If you have any questions, please bring them back. All right, we're going to move to item 7, which is reconvene an executive session. It shouldn't be very long, and we'll be, did I just jinx it?
That's what you say.
So we will reconvene in closed session. Oh,
Okay.
good. Thank you.